Hello everybody. Rebecca Wolser, so glad to be here with you on Crashes and Taxes. It's my first time bringing you into my office at home and doing the podcast from the home office. You can see my little microphone here, or maybe you can't see it, but I will not move it because it's very sensitive and you can hear the show going. I want to share with you, before we get started what we want to talk about today, I want to share with you two things. My book, if you have not gotten this copy of this book, it's a really great book. I wrote it and it came out in beginning of 18, but the information actually is really relevant today because I talk a lot about taxes going up and market crashes. So, and what do we do and how do we invest for the long haul? Because there's things that you can do. So I wanted to share that with you. Wealth Unbroken, you can get it on Amazon, you can get it on Barnes & Noble's, Target, Walmart. Anywhere books are sold, you should be able to get it. And then I want to share with you a couple of the things in my office that I have that I look at all the time. So the first, as a man thinks in his heart, so is he. So I'm doing video this time. If you're listening on the podcast, just so you know, you can get a video of this and see my home office. As a man thinks in his heart, so is he. And then I have this Confucius saying, the man who thinks he can and the man who thinks he can't are both right. The man who thinks he can and the man who thinks he can't are both right. And isn't that just so true? So I want to talk to you today about what is going on with the economy and these rolling shutdowns. And really, let's talk about whether or not it's possible for us to really get back to any kind of normal level of society while we're in the middle of these rolling shutdowns. So consumer sentiment came out this past week, and it was a huge drop. We had obviously a really low number for April because we were at the height of being shut down and the virus, and then obviously after April we started to get consumer sentiment, which we track. If you're in the market, you're tracking consumer sentiment because 70% of our economy is consumer spending. So you want to track consumer sentiment at all times to know that kind of where consumers are, where they think is where and if they will spend money. If they're not thinking positively, they're not going to spend money. If they are thinking positively, they are going to spend money. And so it's really important that we track what they're thinking. And so what you saw is a really huge drop in sentiment in April because of the virus, of course. And then you saw with May a really strong uptick because this is when a lot of people were protesting and started to say, the first protest, and started to say, hey, we need to get back open, get us back to working, let's get ourselves back. And so you started to see an uptick in May and even in June. And then now the numbers that have come out this past week, starting with the beginning of July, ticking back down. To give you a frame of reference, we were at 78 and we dropped to 73, which was almost the low that we had in April. So what this is telling us is that consumers are extremely concerned about the fact that we are not fully reopening and that we started to reopen, and that was what it started to tick us up in May, and then we've started to close back down again. That's a huge problem because we don't have any confidence, consumer confidence, in the fact that we're going to be able to get back to some kind of normal, some level of normal through this coronavirus situation. And so when you look at what that means and where does that leave us, we are really in kind of this boomerang holding period and holding situation if we aren't going to fully commit to normalization with the virus. And I'll talk to you about what that means. And we're not going to fully commit to being locked down as we originally were, and which of course we shouldn't. Then what is our middle ground? And what can we do so that the economy can get restarted and have some level of stability? The CDC just paused cruises from launching and through the end of September, so September 30. By the time September 30 comes, we'll have had cruise lines shut down for 200 days. So this is just really concerning. And there's a lot of people out there, and this is not a political discussion in any capacity. I really don't care what your politics are as long as we're talking economics. But you got a lot of people out there that are really talking about, vaccines and vaccines. We won't be able to get back to a new normal until a vaccine comes about. Well, I have a huge concern about that. The fastest vaccine I've ever seen released to the public was developed over 4 years. 4 years. So if we can cut that in half, that's still 2 years. We're not even at the year point yet. We're 6 months into this thing. So you can see that we can't afford 18 more months of what we've got right now, which is this level of instability of opening and then closing and then opening and then closing. We can't have it. And we have a really hodgepodge patchwork of different things going on throughout the country. So I don't think, for those of you that want to say that when we get a vaccine, that's when we'll get back to normal, I don't think that's a viable option for this country, because this country will go through a Great Depression if our businesses and our workers and our service industry is closed for 18 more months. And that's pushing a vaccine as fast as 2 years. So what is it that's going to have to happen? And I only see really 2 scenarios. I see 2 possible scenarios, and I don't really have any other thing I can think of. So the first scenario is that we sort of agree to all agree. Whether the science is there to support it or not is not something I want to argue on this podcast, but we all agree that basically with masks and with people wearing masks, we can get back to society being somewhat open, and we can basically go back somewhat into normalized society with social distancing and masks. And that's the first thing, and that's without a vaccine. The first thing really in a nutshell is what we call herd immunity. In other words, the virus is here. We don't have a vaccine that effectively deals with it. We have a lot of things that we don't have effective vaccines for, that we live with all the time, that this is another one of those things. And that while it started out highly potentially lethal for those at the highest risk among us, it really peaked, and it's sort of now, what we have now is a lot of case counts. We have the case counts really going up substantially, and this is what you guys have heard in the news. The media has been really obsessed with case counts. But I look at the case counts that they talk about in Florida, Arizona, Texas, and even California, which is why Gavin Newsom shut California down for the most part, with the exception of some things. When you look at case counts, you have to put case counts in a frame of reference, because if you just listen to the news and you just listen to case counts, this is what it does. It freaks investors out. It freaks, everybody out, and they think, oh my gosh, this is, the end of America as we know it, and we've got all these cases, and now what? But case counts going up could actually be a good thing, because what it shows, much like Sweden didn't shut down at all. Never. Not the whole time. They didn't mandate masks. They didn't shut down, and they have a death rate, 5,208 deaths at the date of this podcast, and that's kind of leveled off, and it's done. They're pretty much done. Everything is open and business as usual in Sweden. I kid you not. Their death rates in Europe are similar to other countries that did really strong lockdowns and really definitive and authoritarian lockdowns. So we have Sweden as a barometer of what happens if society just reopens, even without masks. So if we reopen with masks and we accept the fact that it's going to go through our population and it's going to create this herd immunity, then we should no longer be surprised about case counts going up. What we need to look at, and the 2 factors that we need to focus on from an investment perspective to really assess the damage of whether or not we can reopen or can't reopen, are the hospitalizations from coronavirus and the death rates from coronavirus. What I've seen in the statistics that we've looked at is that even though Florida, Texas, California, Arizona have daily case rates that are, setting records and that you've never seen before, even though that is the actual case, the truth is that the death rates of these states are still dropping and are extremely low, not anywhere near like it was in New York and New Jersey at the height of the virus at the very initial stages. So when you have a really high death rate in New York and New Jersey, you have a death rate in Florida somewhere less than 1%. And so as your cases are expanding and more people are voluntarily taking the test, even though they don't feel sick, which is for sure based in Tampa, I'm telling you that's what's happening here in Florida. I drove by a public testing site, which is right off of one of the interstates down here, and the wait was 3 miles long. These people had to literally wait in their car for over 3 to 5 hours to get up to where they were going to be actually tested. And so people waiting in their car 3 hours plus are not sick people. If they're sick, they're going to the doctor if they have one, and if they don't have one, they're going to the hospital. So the fact that people are voluntarily waiting in their car for hours to get tested means they're pretty much probably asymptomatic people, and they have a reason to get tested. They want to know, their employer wants them to have a test, they work in some kind of field that requires a test. Whatever the case is, they're not necessarily feeling sick. So you've got this massive increase in explosion of testing, and you have a massive case count rising with the testing rising, which I will stress again to you is potentially a good thing, because it lets us know that the virus is going through our society. We've got a lot of people that have antibodies and potentially going to have immunity to this virus, and that's where you get the term herd immunity. So that's the first scenario. The question is, will people get on board that this is not the Black Plague, this is not the bubonic plague, it's not death of millions and millions and millions of people, and it's super lethal. It's really, if you look at the data, it's really effectively concerning to people that are over the age of 45 to 60, anybody in that range and up and beyond, and anybody certainly that has any kind of comorbidity. So anybody who's got some kind of sick concerns or some health immunocompromised system, that would be it. So that's the first way. That's the way where I see that we can get this scientific data out there about how Sweden has done this, how other countries have done this successfully, Brazil, and yet we haven't done it here in the States yet. We're still super panicked with this case counts going up. And then the other secondary option, which is a terrible option, is we have to wait to get back to normal until we get a vaccine. And the vaccine has to come whenever the vaccine comes. And that's a really terrible option, because vaccines take a long time. If they skip and move it as fast as possible, what have they skipped doing? Longitudinal tests on a lot of people that say that it's safe. So you're compromising somewhere, right? If people want to say you can't return to school and you can't get back to normal until we have a vaccine, then I'm afraid, my friends, we're going to have a Great Depression on our hands, because our economy, we had a CARES Act passed in April, which is $6 trillion of federal stimulus, which has saved our markets and saved our economy from the collapsing blow they would have felt had we just shut down voluntarily. 42 million people went on unemployment like that. And if we did not have the CARES Act, we would have felt the effects of that kind of voluntary shutdown as fast as you can say, whatever. We would have felt, and you and I would be having a much different conversation if we were in the middle of a depression. So this federal stimulus is what was necessary initially. But if we are not going to get to a vaccine for a couple of years, and we're going to go with these open and closing and open and closing because we have case count rising, we are headed for a depression. And there is no doubt about that. What I'm saying very clearly is if we do not get back to some level of stability of businesses reopening and back to some level of stability of a new normal, whether it's with masks and social distancing or whatever, without a vaccine, then we will wait till a vaccine and we will destroy our economy in the process. And I want to say something to all those people out there that say, oh, you're profits over people. Not at all. Those people that want to politicize this and say you just want the economy back because you just want profits has nothing to do with profits, okay? Let me tell you what has gone up since the virus and since the shutdown. Child abuse cases, marital spouse abuse cases, divorce, alcohol dependency and abuse, drug dependency and abuse, suicides, specifically teen suicides, have gone up exponentially year over year. There are real hardships for people when they lose their job and they don't have a source of economic support for their family. They feel so much stress. They turn to coping mechanisms. Sometimes that involves abusing other people that they're close to. That involves some kind of drug or alcohol or substance abuse. And they become potentially suicidal. There are a lot of ramifications of people that have nothing to do with just businesses and getting back to normal for profit's sake. It is about people. And when you're creating a situation that creates more harm than the virus that you're opposed to going out and being exposed to, then I don't know what to tell you. So what I'm trying to say is, right now, our economy has not felt the sting of coronavirus because we passed the CARES Act federally and we gave ourselves $6 trillion to get through this virus. You know that the $600 per month, per week, monthly, $600 federal dollars per week of unemployment bumped up is due to expire July 31st, and they're debating whether that is going to be extended. There's a lot of cases where people aren't going back to work because they don't have to, because they're getting this extra bump. But then also, can they go back to work, or are we shut down again? So we don't know what's going to happen. But what I do know is that if people are expecting for us to just stimulate this until we get a vaccine, it's not possible. We do not have that kind of money. We're in the decade where everything is changing because the baby boomers are retiring and they're going on Social Security and Medicare. We've got a lot of issues to just deal with just from that alone. We don't need to add to it the fact that we have no stability in reestablishing and restarting the economy. So what we need to do is put our heads together and figure out, hey, are we really going through herd immunity? Can we reopen with and really protect those people that are vulnerable to this coronavirus, which are our older people and people that have compromised immune systems? Those are our high risk categories. Those people should be protected. The rest of everybody else should really get back to work as if this is a flu virus and maybe a little bit more potent than the flu. But the numbers that I'm seeing now from all of the scientific studies across the globe, not just US-based studies, but all kinds of studies across the globe, now show that the virus is less impotent and certainly less even deadly than potentially the influenza virus. So I say all that to say, don't fret it for now, but we definitely have some work ahead of us in America to get the economy back on track. And as we dip, remember, you could have some really good buying opportunities, so don't run from that either. And until next time, and we do another podcast via video, I'll look forward to joining you again on Crashes and